Every week, across countless homes, a familiar ritual unfolds. You step into your garden, identify certain plants as weeds, and with deliberate effort, pull them out, discarding them without a second thought. But what if this routine act of gardening was actually an act of discarding centuries of accumulated medical knowledge? For thousands of years, long before pharmacies existed, healers utilized these very plants to treat infections, reduce inflammation, and even extend life. Today, a growing body of scientific research is confirming their potent biological activity, revealing that you have, in essence, been throwing away free, powerful medicine. This investigation will reveal 7 such plants. The disconnect is striking. While modern medicine often focuses on synthesized compounds, traditional pharmacopoeias, globally, were built upon the plants surrounding communities. This ancient wisdom, often dismissed as folklore, is now being systematically analyzed and, in many cases, validated by peer-reviewed studies. Our journey begins with a plant so common, so reviled by gardeners, that its true medicinal prowess remains largely unknown to the general public, and certainly not prescribed in your doctor's office. This plant is the humble dandelion, a pervasive resident of lawns and cracked pavements everywhere, often seen as nothing more than a stubborn nuisance. Dandelion, scientifically known as Taraxacum officinale, is perhaps the most shocking entry on our list due to its ubiquity. Yet, its historical use as a powerful medicinal agent spans cultures and continents. Traditional Chinese medicine and Native American practices frequently employed dandelion for its liver-supporting properties. Modern research is now providing the biochemical rationale. Studies, such as one published in the Journal of Ethnopharmacology in 2010, have indicated that dandelion extracts can protect liver tissue from damage and promote regeneration. This is attributed to a complex array of bioactive compounds, including sesquiterpene lactones and phenolic acids, which interact synergistically. Beyond liver health, dandelion exhibits significant anti-inflammatory effects. Chronic inflammation is implicated in a host of modern diseases, from arthritis to cardiovascular conditions. Research published in the Food and Chemical Toxicology Journal in 2008 demonstrated that specific compounds found in dandelion, such as taraxasterol and chicoic acid, can effectively inhibit pro-inflammatory mediators. This suggests that dandelion root and leaf extracts may offer a natural strategy for managing inflammatory responses in the body. While not a cure, this evidence points to a mechanism of action that aligns with its traditional use in reducing pain and swelling. Dandelion is also a well-documented diuretic. Its leaves, in particular, have been traditionally used to stimulate urine flow, aiding the body in flushing out excess fluids and toxins. This diuretic action is largely attributed to the plant's high potassium content, which helps balance electrolyte levels, a critical factor often disrupted by synthetic diuretics. A 2009 study in the Journal of Alternative and Complementary Medicine observed a significant increase in the frequency and volume of urination in participants consuming dandelion leaf extract. This supports its role in supporting kidney function and detoxification pathways, making it a valuable, accessible herbal ally for systemic cleansing. Furthermore, dandelion is a powerhouse of antioxidants. These compounds are crucial for neutralizing harmful free radicals in the body, which contribute to cellular damage and accelerated aging. A review published in the journal Oxidative Medicine and Cellular Longevity in 2017 highlighted dandelion's rich profile of polyphenol, flavonoids, and carotenoids. These antioxidants contribute to its overall therapeutic potential, protecting against oxidative stress linked to various chronic diseases. The cumulative effect of these properties underscores why this common weed has been revered as a tonic by herbalists for millennia, providing a holistic approach to wellness often overlooked. Perhaps the most compelling and actively researched area regarding dandelion is its potential role in cancer prevention and treatment. While still in early stages and predominantly in vitro or animal studies, preliminary findings are significant. Research from the University of Windsor's Department of Chemistry and Biochemistry, published in Oncotarget in 2012, has shown that dandelion root extract can selectively induce apoptosis, programmed cell death, in various human cancer cell lines, including leukemia, colon, and pancreatic cancers, while leaving healthy cells unharmed. This distinction is crucial and hints at a highly targeted therapeutic action, meriting continued rigorous investigation into its mechanisms and applications. Moving from the pervasive dandelion, we turn our attention to another garden staple often overlooked, plantain, specifically Plantago major, or broadleaf plantain. This unassuming plant, with its ribbed leaves, is frequently found thriving in compacted soil along pathways and driveways. Historically, it has earned the moniker wilderness band-aid due to its remarkable ability to aid in wound healing. For centuries, across cultures from ancient Greece to Native American tribes, plantain leaves were crushed and applied directly to cuts, insect bites, and stings. This traditional application is now backed by a growing body of scientific inquiry into its mechanisms. The efficacy of plantain in wound care is attributed to several key constituents. Foremost among these is allantoin, a compound known for its cell-proliferant properties, meaning it stimulates the growth of new, healthy tissue. Additionally, plantain contains aucubin, an iridoid glycoside with proven antimicrobial activity, which helps prevent infection in open wounds. Furthermore, the presence of mucilage forms a protective barrier, soothing irritated skin, while tannins act as astringents, helping to stop bleeding and tighten tissues. This multifaceted biochemical profile explains its traditional success in treating various skin traumas, from minor abrasions to more significant wounds. Research has substantiated plantain's anti-inflammatory and antimicrobial properties. A study published in Phytotherapy Research in 2009 demonstrated that plantain extracts significantly reduced inflammation in animal models, supporting its use for conditions like insect stings and allergic skin reactions. Concurrently, its aucubin content has been shown to inhibit the growth of several pathogenic bacteria, including Staphylococcus aureus, a common cause of skin infections. This dual action, reducing swelling and combating microbes, makes plantain an invaluable natural resource for topical application, effectively creating a sterile, healing environment directly on the skin's surface without synthetic intervention. Historically, one of the most common ways to utilize plantain was through a poultice. Fresh leaves would be chewed or crushed to release their juices and then applied directly to the affected area, often secured with a bandage. This simple, effective method allowed the active compounds to directly interact with the wound or irritation. A traditional remedy passed down through generations, this practice offered immediate relief from itching, pain, and swelling caused by bee stings, mosquito bites, or minor cuts. The efficacy of this folk remedy, once purely anecdotal, now finds its scientific underpinning in the plant's documented biochemical profile. While plantain is largely recognized for its external applications, it also possesses internal benefits. The mucilage content makes it an excellent demulcent, meaning it can soothe irritated mucous membranes throughout the digestive and respiratory tracts. Traditionally, plantain tea has been used to alleviate coughs, bronchitis, and mild stomach upset. Its anti-inflammatory properties can also extend to the gut lining, potentially offering relief for conditions like irritable bowel syndrome or gastritis. Though less commonly discussed than its topical uses, this internal application further demonstrates the plant's versatility as a holistic medicinal agent, addressing internal inflammation and irritation. Next on our investigative tour is stinging nettle, or Urtica dioica. Many gardeners dread encounters with nettle due to its infamous stinging hairs, which inject a cocktail of chemicals, including histamine and formic acid, upon contact. Yet, beneath this prickly defense lies a plant of immense medicinal value, often referred to as a superfood due to its dense nutritional profile. For centuries, nettle has been harvested carefully and used extensively in traditional European herbalism for a wide array of ailments, from joint pain to seasonal allergies. Its powerful constituents offer benefits that starkly contrast with its initial painful impression. One of nettle's most compelling modern applications is in the management of seasonal allergies, particularly hay fever. Paradoxically, the very chemicals that cause a sting, like histamine, when consumed in processed forms, appear to modulate the body's allergic response. Studies suggest that nettle can inhibit the release of histamine from mast cells, thus reducing symptoms such as sneezing, watery eyes, and nasal congestion. A double-blind, placebo-controlled study published in Plantain in 2000 indicated that freeze-dried nettle leaf can provide relief for hay fever sufferers, positioning it as a potent natural alternative for allergy management, albeit requiring consistent intake. Beyond allergies, nettle has a strong traditional and emerging scientific basis for its anti-inflammatory effects, particularly concerning joint pain. The plant contains flavonoids, phenolic compounds, and even sterols that contribute to its ability to modulate inflammatory pathways. A review in the Journal of Ethnopharmacology in 2004 highlighted nettle's use in osteoarthritis and rheumatoid arthritis, suggesting that its extracts can reduce the expression of inflammatory cytokines. Patients suffering from chronic joint pain have historically used nettle topically as a urtication therapy, applying fresh nettle to stimulate localized inflammation, which paradoxically can alleviate deeper, chronic pain. A particularly well-researched area for nettle root extract is its efficacy in treating benign prostatic hyperplasia, or BPH, a common condition in aging men that leads to urinary issues. Numerous clinical trials, often cited in urological journals, have shown that nettle root can significantly reduce BPH symptoms, including frequent urination and incomplete bladder emptying. While the exact mechanism is not fully understood, it's believed to involve compounds that interfere with hormones influencing prostate growth, as well as its anti-inflammatory properties. This demonstrates a specific, medically recognized application of a common weed, offering a natural intervention for a widespread age-related issue. Beyond its medicinal compounds, nettle stands out as a nutritional powerhouse. When cooked or dried, its stinging properties are neutralized, revealing a nutrient-dense food. It is exceptionally rich in vitamins A, C, and K, as well as several B vitamins. Furthermore, nettle provides a significant array of essential minerals, including iron, calcium, magnesium, and potassium. It even contains a notable amount of protein for a leafy green. This rich nutritional profile makes nettle a valuable addition to the diet, especially in times when diverse food sources were scarce, explaining its historical role as a spring tonic to replenish depleted nutrient stores after winter. Nettle's versatility extends to several other traditional uses, many of which are now drawing scientific interest. It has been historically employed as a hair tonic, believed to stimulate hair growth and combat dandruff, likely due to its high mineral content and anti-inflammatory action on the scalp. Furthermore, its diuretic properties, similar to dandelion, have made it a traditional remedy for urinary tract infections and kidney stones, helping to flush the system. While less studied than its allergy and prostate applications, these long-standing traditional uses underscore a broad spectrum of benefits, painting a picture of nettle as a multi-purpose medicinal herb. From the stinging nettle, we transition to a far more gentle, yet equally potent, garden resident, chickweed, or Stellaria media. This delicate, low-growing plant with tiny white star-shaped flowers is a familiar sight in cool, moist, and shady areas of gardens worldwide. Often considered a persistent weed due to its rapid growth, chickweed has a rich history as a medicinal herb, particularly renowned for its soothing and healing properties for the skin. Its application in traditional European herbalism has primarily focused on alleviating various dermatological discomforts, offering a gentle yet effective botanical intervention for common skin issues. Chickweed's effectiveness in skin care is primarily attributed to its saponin and flavonoid content, alongside a notable amount of vitamin C and various minerals. Saponins, a class of soap-like compounds, contribute to its emollient properties, helping to soften and moisturize the skin. Flavonoids are powerful antioxidants and anti-inflammatory agents, reducing redness and irritation. Together, these compounds work synergistically to provide a soothing, healing effect. The mucilage present also creates a protective layer, aiding in the repair of damaged skin, making chickweed a multifunctional botanical for a range of dermatological concerns, often without adverse reactions. For centuries, chickweed has been a go-to remedy for a variety of persistent and uncomfortable skin conditions. It has been traditionally applied as a poultice or salve to relieve the itching and inflammation associated with eczema, psoriasis, and dermatitis. Its cooling and soothing properties can bring immediate relief to irritated skin, reducing the urge to scratch, which can further exacerbate symptoms. While formal large-scale clinical trials specifically on chickweed for these conditions are limited, anecdotal evidence and smaller in vitro studies support its anti-inflammatory and wound-healing potential, reinforcing its historical use in alleviating chronic skin discomforts. Similar to plantain, chickweed also finds application in treating minor cuts, burns, and insect bites. Its mild antiseptic properties, stemming from its various plant compounds, help to cleanse wounds and prevent infection. The demulcent action of its mucilage aids in soothing the pain and discomfort of minor burns, while its anti-inflammatory effects can reduce swelling and redness from insect stings. The convenience of finding chickweed readily available in many backyards makes it an accessible first-aid plant, offering a gentle, natural alternative for common minor skin injuries. This reinforces the idea that effective remedies can often be found close to home. Next, we delve into a plant that challenges the very definition of a weed due to its extraordinary nutritional profile, purslane, or Portulaca oleracea. This succulent, fleshy-leaved plant often sprawls across garden beds, easily mistaken for a simple nuisance. Yet, it is revered in many global cuisines, from the Mediterranean to India, and boasts an unparalleled nutritional content, especially for a wild plant. Scientists have increasingly focused on purslane for its astonishing levels of omega-3 fatty acids, making it a standout in the plant kingdom and a prime example of nature's hidden superfoods. What makes purslane truly exceptional is its omega-3 fatty acid content, specifically alpha-linolenic acid, ALA. Purslane contains more omega-3s than any other leafy green vegetable studied to date. A 1992 study published in the American Journal of Clinical Nutrition highlighted that purslane contains 300 to 400 milligrams of ALA per 100 grams, a staggering amount compared to most cultivated vegetables. This is critical because omega-3s are essential fatty acids, meaning our bodies cannot produce them and we must obtain them through diet. They play vital roles in heart health, brain function, and inflammation regulation, underscoring purslane's immense dietary value. Beyond omega-3s, purslane is a treasure trove of antioxidants. It boasts high levels of vitamins A, C, and E, all potent antioxidants that protect cells from oxidative damage. Furthermore, it contains unique antioxidants like glutathione, an important detoxifier, and melatonin, which is typically associated with sleep regulation but also acts as a powerful antioxidant in plants. These compounds collectively contribute to purslane's ability to combat free radicals, reduce inflammation, and potentially slow down cellular aging. Its comprehensive antioxidant profile makes it not just a food, but a functional ingredient with significant protective health benefits. The high omega-3 content and antioxidant profile of purslane translate into significant cardiovascular benefits. Regular consumption of omega-3 fatty acids is strongly linked to reduced risk of heart disease by lowering triglyceride levels, reducing blood pressure, and improving endothelial function. A study in the American Heart Journal noted the positive impact of dietary omega-3s on cardiovascular markers. The plant's rich potassium content also contributes to blood pressure regulation. These attributes position purslane as a natural ally for heart health, offering a plant-based approach to managing key risk factors for cardiovascular disease, accessible directly from your garden. Emerging research also points to purslane's anti-diabetic potential. Several animal studies and some preliminary human trials have investigated its effects on blood glucose regulation. Compounds in purslane, including certain flavonoids and polysaccharides, appear to improve insulin sensitivity and reduce blood sugar levels. A review in the journal Evidence-Based Complementary and Alternative Medicine discussed its hypoglycemic effects, suggesting it could be a supportive dietary component for individuals managing type 2 diabetes. While not a standalone treatment, integrating purslane into the diet could offer a complementary strategy for metabolic health, leveraging its natural compounds for blood sugar balance. To fully appreciate purslane's nutritional superiority, a comparison with common cultivated vegetables is insightful. While spinach and kale are celebrated for their health benefits, purslane often outshines them in specific metrics, especially its omega-3 content. For example, 100 grams of purslane can contain up to 400 milligrams of alpha-linolenic acid, whereas spinach might offer only around 27 milligrams, and kale approximately 92 milligrams. This stark contrast highlights that some of our most overlooked weeds possess nutritional profiles that rival or even surpass our carefully cultivated crops, challenging our perception of what constitutes a valuable food source. This free medicine truly grows abundantly. Finally, we investigate Cleavers, or Galium aperine, a plant instantly recognizable by its sticky, clinging nature, earning it nicknames like Sticky Willy or Bedstraw. This common garden weed, often dismissed as a nuisance for its ability to adhere to clothing and animal fur, possesses profound medicinal properties, particularly for the lymphatic system. Traditional European herbalists have long revered Cleavers as a powerful lymphatic tonic and diuretic, making it a staple in spring cleanses and detoxification protocols. Its unique compounds provide a gentle yet effective way to support the body's natural waste removal processes, often overlooked. The lymphatic system is a critical, yet often neglected, part of our immune system, responsible for removing waste products, toxins, and excess fluid from tissues. Cleavers is highly regarded for its ability to stimulate and support lymphatic drainage. This action helps reduce fluid retention, particularly in swollen glands and tissues. Research, though predominantly observational and in vitro, suggests that the plant's flavonoids and iridoid glycosides contribute to this effect, enhancing the flow of lymph. For conditions like swollen lymph nodes, mild edema, or even chronic fatigue, Cleavers has been traditionally employed to encourage systemic cleansing and optimize immune function. Alongside its lymphatic effects, Cleavers is a well-established diuretic, aiding the kidneys in increasing urine production. This property makes it an excellent herb for supporting urinary tract health and preventing the formation of kidney stones. Its gentle action helps flush out toxins and irritants from the bladder and kidneys, offering relief for mild urinary tract infections and promoting overall urinary hygiene. The presence of coumarins and tannins contributes to these effects. Traditional uses often involve drinking Cleavers as a cooling tea, particularly during warmer months, to maintain fluid balance and assist with detoxifying the body through increased urination. Due to its lymphatic and diuretic actions, Cleavers is also traditionally employed for skin conditions that are believed to have an internal origin, such as acne, boils, and certain types of eczema. By promoting the elimination of waste products and toxins from the body, it is thought to cleanse the blood and improve skin clarity. Herbalists often recommend Cleavers as part of a broader detoxification regimen, particularly in the spring, to help the body shed impurities accumulated over winter. While direct dermatological studies on Cleavers are fewer, its systemic effects on detoxification underscore its potential as a supportive botanical for overall skin health and vitality. Beyond its medicinal applications, Cleavers, particularly the young shoots, can be incorporated into the diet. Like many of the plants discussed, when gathered early in spring, the tender leaves and stems can be steamed, juiced, or added to soups and salads. Cooking neutralizes some of the bristly texture, making it more palatable. This allows for a direct intake of its beneficial compounds as part of a meal. Traditionally, a spring tonic tea made from Cleavers was common, often combined with other cleansing herbs. This dual role as both food and medicine highlights the integral connection between diet and health in traditional practices, a connection we often lose sight of in modern society. We have explored dandelion, plantain, nettle, chickweed, purslane, and cleavers, 6 common weeds that emerge from your soil with tenacity, and yet, harbor potent medicinal secrets now being unlocked by scientific research. Each plant, from dandelion's liver support to plantain's wound healing, nettle's allergy relief, chickweed's skin soothing, purslane's omega-3 richness, and cleaver's lymphatic cleansing, represents a chapter in a vast, often forgotten pharmacopoeia. These are not just botanical curiosities, they are living testaments to an ancient wisdom that recognized the profound connection between nature and health, a connection that modern science is steadily re-establishing. The term weed is fundamentally a human construct, applied to any plant deemed undesirable in a particular setting. But as this investigation has revealed, many of these so-called weeds are not only beneficial but possess therapeutic properties that rival or even surpass some pharmaceutical compounds, often without the associated side effects. They are, in essence, wild, free medicine, thriving in your own backyard, waiting to be recognized and utilized. This challenges us to reevaluate our perspective, not just on gardening, but on our relationship with the natural world and the pharmaceutical industry that often overlooks these accessible remedies. Imagine your garden, not just as a space for cultivation or recreation, but as a dynamic living pharmacy, offering potent remedies for everyday ailments, available at no cost. This shift in perspective can empower individuals to take a more proactive role in their health and well-being, leveraging the incredible healing potential that nature so generously provides. The plants we've discussed are merely a fraction of the vast botanical arsenal surrounding us. This deep dive serves as an invitation to look closer, to research further, and to begin to see the extraordinary in the ordinary, the powerful medicine hiding in plain sight. Your backyard holds more secrets than you think. While the scientific evidence and traditional uses presented in this investigation are compelling, it is crucial to emphasize that this video is for informational purposes only. The information provided here is not intended to diagnose, treat, cure, or prevent any disease. Always consult with a qualified healthcare professional, such as a doctor or a clinical herbalist, before incorporating any new herbal remedies into your health regimen, especially if you have existing health conditions, are pregnant, breastfeeding, or taking prescription medications. Interactions and dosages can be complex, and professional guidance is always recommended for safe and effective use. Prioritize your safety and well-being.